Hope was rekindled for sufferers of fistula in Nigeria as the Minister of State for the Federal Capital Territory, Hajiya Dr. Ramatu Tijjani Aliyu, pledged to rehabilitate patients of vesico-vaginal fistula, also known as VVF, who have successfully undergone repairs in the country. The minister made the promise when he visited the Kwali General Hospital in the FCT to witness the third batch of repairs of fistula patients, a program put together by the Survive Fistula Healthcare Foundation, SFHF, an Abuja-based non-governmental organization in partnership with its international partners, Christopher Blinden Mission, CBM, Hajiya Dr. Ramatu Tijjani Aliyu, who was represented by the acting executive secretary of the FCT Primary Healthcare Board, Dr. Ndayo Iwot, commended the effort of the SFHF and its partners, even as he urged them to keep up the good job.
The state of emergency has been declared on maternal and child health in FCT. That is to say, all the people, including this organization, working on maternal and child reproductive health as a whole, will come under one umbrella. We are going to develop one plan. We are going to work together, form community managerial structure for primary health care, where community members will be part of that. We are saying no to vesico-vaginal fistula or any form of fistula coming from childbirth. So we need to do more. So as these people are going through here now, they are not only stopping at arranging for people to be operated on, but the rehabilitation, which is where the Excellency has come in, the Honorable Minister of State, FCT. She is interested in it because she knows very, very well, no matter what you are doing now, these women will have to move to the next level of their lives. All the ostracization, the children that might have run away, the husbands would come back and see this woman being empowered, being useful not only to herself, to her family, but the community at large.
At a later date, we are going to invite all the service users that had their fistula successfully repaired. We are going to recognize them. We are going to empower them. So on behalf of the minister, once again, let me say big thank you to the facilitator.
Also speaking at the event were Dr. Saad Idris, a senior fistula surgeon, trainer who doubles as the chief medical director, Wuse General Hospital, and Dr. Halima Bello Lawal, medical director, Kwali General Hospital, who urged women to attend complete antenatal care when pregnant in order to prevent fistula from occurring.
With all the challenges like the insecurity, the economic meltdown, it's further confounding the existing challenges of lack of enough medical personnel, lack of facilities for adequate or proper antenatal care. Then you have maternal mortality, and then you have morbidity. And one of the key morbidities is the fistula. Those that are lucky to survive after suffering from labor and its complications, they may end up having a fistula. I commend the government and the NGOs who are really supporting this program. And some of us made sacrifices to come because this is where we can touch the life directly. You couldn't have done it without the support of the partners, especially Madam here that has really been in the system, Survive Fistula Healthcare Foundation. They are doing wonderfully very well.
I would always advise that prevention is better than cure. We here are repairing, but we are also trying to advocate prevention. And what is this prevention? When women come for antenatal care, they are checked during their pregnancies until delivery time. They are monitored during delivery time until they have their babies. In this way, it helps a long way. It helps a lot to prevent women from having prolonged obstetrical labor, because what brings about this fistula in most of the women is prolonged obstetrical labor.
Survive Fistula Healthcare Foundation has been actively engaged in awareness creation to the various strata of the society, coupled with radio and television jingles as a means of ensuring reduction in the prevalence rate of VVF in Nigeria. Only recently, between July and August 2020, the NGO successfully repaired 16 fistula patients in Abuja, as well as doing the third batch of repairs. Mrs. Peters Ogumayi Olushaye is the executive director of SFHF, and here she tells us more about the event.
Because of limited funds we have, we couldn't even expand more. These women are there. We want to expand. We want to move ahead. Like this is our third batch of fistula repair in FCT. We have recorded success story on all of them. And this one now is the third batch where we are having very aged women. There's a woman there in the world, she's about 80 years. Like two of them, they are about 80, 81 or 79 years old. They've been having fistula for like 40 years. They've been having fistula for like 30 years.
These are testimonies of some of the fistula patients that had been successfully repaired by the NGO.
I have this problem when I brought here at my first delivery. So when I give birth to this my child at Kuje, so the nurse now advised me, when she see this my problem, now advise me that there is caring people like this that is helping people free of charge, and they will do the surgery. So that's now I came here. Thank God those people. I didn't know them, but Almighty Allah know them. They will continue. Allah will continue to guide them and protect them.
After 1 week of CSC, what they do for me, and I started seeing waters. May God reward them the good work that they are doing.
I appeal to every woman in this country to come out when they are pregnant, to attend antenatal clinic, attend antenatal, where there is no money, where the distance is so far. At least throughout the 9 months of your pregnancy, you should be able to attend clinic at least 2, 3, 4 times before you deliver. Please endeavor to go to facility for antenatal care and for hospital delivery. And if you know that your previous pregnancy delivery was through cesarean section, don't try to labor and to have that delivery vaginally. Come to hospital to avoid problems that you alone will face. Because if fistula occur, your parents will abandon you, your husband will abandon you, your social life will be zero. So the best thing is to come out to have your delivery in the facility.
Going by the statistics, an estimated figure of 3,000 women suffering the condition are treated yearly, and with the latest assurance from the minister, it is the expectation of many that better days await these category of Nigerians, as such intervention will go a long way in mitigating the harrowing experiences that go with the health condition.